During Week 3 of the NFL season, elite edge rusher from the San Francisco 49ers, Nick Bosa, suffered an ACL injury against the Arizona Cardinals. My name is Ryan, I'm a physical therapist, and today I'm going to go over the anatomy of this injury, the mechanism of this injury, the characteristics and clinical presentation, as well as recovery. So here's a play of when Nick Bosa actually did injure his ACL. However, from this angle, it's very difficult to say or see what exactly happened and what caused the injury. So they later show that Nick Bosa on the sideline heading right to the ground in a lot of pain, unable to be on that leg, later confirming that it is indeed a torn ACL. So what is the ACL? So the ACL is a dense connective tissue as seen starting at the femur right here and then goes more anteriorly where it does attach or insert at the tibia right over here. The main role of the ACL is to prevent excessive anterior translation of that tibia. So that's going right here as well as extra or rotational loads. These rotational loads include varus or valgus knee angulation with full knee extension. Common mechanism of injury for an ACL tear includes a cut and plant movement. That is typically when the foot is planted on the ground. The knee is typically externally rotated and in about slight flexion, about 10 to 30 degrees, where the knee is placed in a valgus position as an athlete would take off from the planted foot and internally rotates with the aim of suddenly changing the direction. During a cutting maneuver where there is already excessive tension on the ACL, this may lead to excessive force, which leads to a failure of that ligament. Now, with all ligamentous injuries, there are grades to each. Grade 1 is considered when the ligament is stretched, but there's no official tear. Grade 2 is considered when the fibers of the ligament are partially torn, or is there a complete tear with hemorrhage or excessive bleeding. And then we do have grade 3, which is when the fibers of the ligament are completely torn or ruptured. So how would a patient present if they were to suffer an ACL tear? Typically, it would occur after that cutting maneuver as discussed earlier, or even after a single leg standing, landing, or jumping. There's a good chance that a person would hear an audible pop or crack when the injury did happen. There will be initial instability, however, it will be masked by excessive swelling later on. There could be episodes of giving away, especially on pivoting or twisting motions. There's going to be extreme pain as well throughout that knee joint, with swelling, restricted motion, as well as mild tenderness. Now, therapists do have ways to diagnose if there is an ACL tear. The first test being the Lockman's test. This is when the patient is in supine and their knee is about 20 to 30 degrees in flexion. The examiner should put their hand behind the tibia as seen right here, as well as one hand above the patient's thigh. Examiner's thumb is on that tibial tuberosity, and the tibia should be pulled anteriorly, where an intact ACL should prevent forward translation or movement of the tibia on the femur. A positive test would indicate that there's anterior translation of the tibia associated with a soft or mushy end feel. The second test is the anterior drawer test of the knee. Patient will be also supine and their hips will be flexed to about 45 degrees and their knee flexed to about 90 degrees as seen there. The examiner sits on the toes of the patient, which helps stabilize the knee, and then just grasps the proximal lower leg just below the tibial plateau. This is where they're going to attempt to translate the lower leg anteriorly, and the test is then considered positive if there is a lack of end feel or excessive anterior translation relative to that contralateral side. So typically, if it is a grade 3 ACL tear, surgery is definitely an option. Now, a type of surgery that is completed is ACL reconstruction. So for this, they are using a hamstring graft as seen right here. And in this video, you see that they remove a portion of the tendon of the semitendinosus as well as the gracilis muscles. Here, they're showing that they are taking the tendons of those hamstrings and sewing them together to make a very strong graft to replace the damaged ACL. And as you see here, they are cleaning up that knee joint, removing the damaged ACL to clean out the area. Here, they drill the holes into the tibia and femur. This is where that graft is going to be placed. They then do place the graft through the holes where it is stitched together and secured as seen there. Now, unfortunately, because of Nick Bosa's ACL injury as well as the severity of the injury, his team decided to undergo surgery, which will then take him out for the remainder of this 2025-2026 NFL season. And typically for a return to sports after sustaining this type of injury and going through the surgery, it's going to take about 9 to 12 months for Nick Bosa to get back onto the field. Hope you enjoyed the video. I hope you learned a little bit about ACL injuries, and thank you so much for watching.